If you think about the largest volume or mass of matter in a building, everybody will tell you it's concrete or steel, it's the support structure, but actually the largest volume is air, and it's actually the air we breathe. So if you follow that line of logic, you're going to begin to realize that the health of human beings has a lot to do with the air we breathe in buildings. About 20 plus years ago I got into this because I realized that the materials and the systems that we were putting into buildings were in those days really making people sick. We knew about what was called sick building syndrome, this awful odor coming off of carpets that everybody knew about back in probably in the 1980s. And so slowly got involved in understanding what the problem was and then trying to figure out solutions. San Francisco Public Library was the first major public building in the United States to have most of the interior materials tested for chemical emissions. Now in those days we didn't know what to do with those test reports. We were getting information out of them. We learned that there was some chemical emissions, but we didn't know what the dangers were. And the second project, which is sort of a follow-on from that, we used all that data. We worked on a very large state office building for the state of California, which was actually the Department of Education headquarters in Sacramento. And there, for the first time, we were able to connect, before we actually built the building, connect chemical emissions from building products to long-term human health implications, carcinogens, reproductive toxicants, and long-term irritants. And because of that, we wrote a specification that was used on that project and is now a national standard. It's actually in some of the international green construction codes, the California Green Building Code, and ASHRAE 189.